Good morning, guys. My name is Precious and I'm a third-year medical student in Atlanta, Georgia. Today I'm going to be showing you guys what a day in the life is like for a third-year med student. So I'd like to thank Dr. Webb for inviting me on his channel to this collaboration. A few months back we actually did a collab on my channel when I was a second-year med student, so I was able to show what's that like during the clinical years. So I'm excited now that I'm in third year to be able to show what it's like to be on the wards, have rotations and different things like that. So currently I'm on my surgery rotation. This is the first rotation that I started with. I'm doing my subspecialty right now, which is ENT. This is actually my last day of ENT and it's been great so far. So right now I'm about to head to the hospital. But before I head to the hospital, I'm just going to eat some breakfast. It is always important to eat a good breakfast before you head for like a long day of clinicals. Yesterday, all I had was an apple in the morning and I regretted that. I was so low on energy. Alrighty, I just got to the hospital. Today is going to be an OR day. Pretty much we just have cases in the OR all day, and on OR days we have to wear scrubs. So I'm in my scrubs today. We don't actually wear our own scrubs in the operating room. We have to wear hospital issued scrubs, so I'm about to go pick those up right now. Alright, so I picked up my scrubs and I'm quickly about to change because the first case is at 8 o'clock. Alright, so I just want to show you guys exactly what we wear. We would have a head cover, face mask, and shoe covers, and then I would have to scrub in and then put a gown on over this. So I'm about to head over to the OR now. I'm gonna just put my stuff in a locker. So I am now on my lunch break. See what time it is. About 12:45. We had 3 cases this morning, and so I'm at one of the off-site hospitals. So pretty much they have OR days, they have clinic days. In the OR, the medical student's role is pretty much to like help with retracting, cutting the sutures. If they're comfortable, they will let you suture, things like that. In the clinic, I've been pretty much with the residents. With this ENT clinic, I have more of an observational role, but this is my last day, so when I move to general surgery, I'll start having, my own patients, rounding on them, doing history and physicals, and, presenting. Yeah, so far ENT has been cool. ENT is ear, nose, and throat, so they deal with the removal of a lot of throat cancers, mouth cancers, fixing deviated septums. They deal with sinus issues, congestion issues, things of that nature. Today, one of the cases was a tracheotomy was placed. So the patient came in last week, and when he came in, he was just complaining of like, hoarseness and difficulty talking. And so the doctor scoped him, put a camera down his nose through the throat, and she saw that it's most likely throat cancer. And she told him that the tracheotomy was needed, so he had that done today. And it's just gonna be like a long road for him, most likely. Chemotherapy or complete laryngectomy, which he doesn't want. That's when afterwards you talk with that voice box, that different voice, and he really wants to keep his voice. So just seeing him after he had the tracheotomy placed today it was tough seeing him. Like, he really looked defeated. I'm interested in emergency medicine myself, and I feel like some people like to have that whole, continuity of care. They're with the patient throughout the long haul, but I think I'm fine just, dealing with the issue at hand and then the patient moving on, because yeah, depending on what specialty you're in, like, it can be, emotionally taxing. So I'm just gonna finish eating up this lunch that I packed for today, and then we have some more cases for the afternoon, and then the day will be done. So for now, I'm gonna toss it over to Dr. Webb and see what he's up to.
Thank you, Precious, for that. For those who don't know who I am Dr. Webb, a PGY-5 Orthopedic Surgery resident in San Antonio, Texas. Right now, I'm on a trauma rotation, which means that I deal with patients who have broken bones, who come in through the ER, whether that's from a car accident, MCC, which is a motor cycle collision. They can be from falls, patients who break their hips, patients who fall and they trip and fall and break their wrists. We see patients with gunshot wounds, patients from who are newborns, all the way up to, I operate on a patient who was 107 years old. So In orthopedic surgery residency, it's 5 years long. You have to apply for it in your 4th year of medical school, and it's really competitive to get into. I think it's a really gratifying specialty. I love it. The hours are long. You have to be really good at your hands and your hand-eye coordination. You have to really think on your feet really quickly, but overall, I'm enjoying it. I finished my residency here in the next 9 months, and then I'm doing a spine fellowship out in Dallas.
Alrighty, I am home. It was a pretty busy day. I'm just gonna change out of these scrubs. So today was probably the busiest day that I had over the 2 weeks of ENT. We had a lot of surgeries today, and I was able to assist a lot in the OR, which was nice. And so now the ENT is over, I'm going to be moving on to general surgery for 2 weeks. So at my school, our surgery rotation is 8 weeks long. So we have 2 weeks of subspecialty, which is ENT for me, and then 2 weeks of general surgery, 2 weeks of trauma surgery, 1 week of colorectal surgery, and then the final week is kind of like an off week where we're studying for our shelf exam, because at the end of that rotation we do have to take a mini board exam. And so that's what I have lined up for surgery. And then after surgery I have 8 weeks of OB-GYN. And one thing about third year is that, like, even though you're done with the preclinical years and done with being in the classroom all day, every day, you know, you still have to study. You do take the exams at the end of every rotation. You know, you have to study up and be prepared for the cases, be prepared for the patients that you're seeing every day. So yeah, when you're done with the day, when you're done with clinical for the day, you pretty much come home and study. But I will say, I feel like I'm studying with like more of a purpose. You know, first, second year, you're like studying so you can do well on the exam, do it on the quiz. Now you're studying because you need to do good for your patients. Like, you need to know their diseases, you need to know the treatment, things like that. So I feel like I have more of a purpose when I'm studying now, which is better, I guess. So for surgery, I have been using Dr. Pastana's notes. This was highly recommended, and it can fit into like your white coat pocket. So like during ENT clinic, in between patients and I had downtime, I'll just flip through this. This one, Di Virgilio, this is also a pretty good one for surgery. I love the format and the way that it's structured. And then my third major resource is online med ed. So they have online video lectures. They also come with notes, which I use, and then they come with practice questions. So those are my 3 main resources for surgery rotation. So pretty much for the rest of the day, I'm just going to be reviewing some of the things that I saw today in the OR, because I feel like when you see certain topics and then you go home and review it, it helps it stick better. It helps stick better, pretty much, for me at least. And then we do have lecture as well, so I'm going to review some of the lectures from last week.
So Precious kind of mentioned some of the books that she uses to study for surgery. In surgery, for orthopedic surgery specifically, the books that I kind of use to study and I have here in my call room are Surgical Exposures to Orthopedics. And it goes over the approaches to surgery for different surgeries. So for a patient who, if I'm doing a knee surgery for some particular reason, I review the anatomy, and it goes over step by step how to basically not necessarily do all the parts of surgery, but to do the approach. So it's called surgical approach, where you make your incision here, you cut through this layer of the skin, you go through these muscles here, and then you move the nerve out of the way this way, and then you fix your fracture or fix whatever you're going in there to fix. But so I use this book here, Anatomic Approach, Surgical Exposures in Orthopedics. And also, it's a volume book. It's called Operative Techniques, Orthopedic Surgery. So this is volume number 4. And I have this really thick book, fits here. And there's another book here this big. So whenever there is a surgery that I'm doing, and if I need to review the anatomy or the approach, I use these books here. For my boards, if you haven't watched my video about my board preparation, after your 5 years of surgery residency, you take your board exam to become board certified using a book called Miller's Review of Orthopedics. This is similar to first aid. If you're in medical school, you know about first aid, and you know that you mark up first aid because it's just a really big snapshot of everything that you need to know. So just like first aid, for this book here, for our boards, I mark in this book here, I even put tabs on it for the different sections. So I wrote some stuff here, wrote some stuff on this page, highlights, all this stuff here. So this really doesn't give you everything that you need to know, but it's similar to first aid in that it's just a really, like I said, big snapshot. So this is what I'm using for my boards. Check out my other video about what my plan is for doing questions for the exam. So I think questions are key, but these are the books here. We're gonna pop it back over to Precious and see how she's doing.
All right, guys, so I'm gonna go ahead and wrap up my day. I hope you guys enjoyed and got a good glimpse of what it's like to be a third-year medical student. This is one day, so of course there is more variety. And on my channel, White Coat Chronicles, I make a lot of vlogs and a lot of videos showing what it's like to be a medical student. So make sure to check out my channel. A link to that is going to be in the description box. And also I have a lot of pre-med advice videos. So if you're interested in going to medical school, if you have questions about the process, definitely check out some of the videos that I have made. And I want to thank Dr. Webb once again for allowing me to be on his channel. It was great collaborating with him again. I hope you guys enjoyed the video. Make sure you give it a thumbs up. Make sure you check out my channel. See you guys next time. Bye.
All right, thank you guys for watching this video, and also thank you to Precious for the collaboration. I'm in the physician's lounge up here on the 3rd floor. It's kind of right outside of our operating room. I'm about to head back down to the ER and see what's going on, and see if there's any patients that would need our services tonight from an orthopedic surgery standpoint. Otherwise, I'm gonna try to do some studying and also get some sleep. I have some surgeries to do tomorrow in the morning. Thank you guys for watching this video. Make sure you subscribe. New videos coming every week. You don't want to miss them. We'll see you next time.